All right, let's jump right in. Today, we're talking about spasticity, a condition that's a daily battle for so many people. We're going to climb what's called the treatment ladder to break down all the different options, from the simplest first steps to the most complex surgeries. So, before we get into the science, just take a look at this. This really captures the heart of what spasticity is. It's the body's own muscles in a constant tug of war, pulling limbs into positions that can be painful and honestly debilitating. This goes way beyond a medical diagnosis. It's a real physical fight every single day. So, what's actually happening in the body? Well, here's the clinical definition. But to put it simply, think of it like the wiring's gone a bit haywire. The brain is sending faulty signals down to the muscles, telling them to stay tight, to stay contracted. It's a massive overreaction, an overactive stretch reflex that literally fights against any attempt to move. And it's important to remember, spasticity isn't really a disease in itself. It's a symptom. It's the result of some kind of damage to the central nervous system, the brain or the spinal cord. And as you can see, the causes are all over the map, from stroke to MS to traumatic injuries and even cerebral palsy. And just to give you an idea of the scale, let's just take one of those causes, stroke. Get this, around half of all stroke survivors will have to deal with some form of spasticity. That is a huge number of people whose recovery gets a whole lot more complicated because of this. And you can imagine, this completely changes someone's day-to-day life. I mean, look at what's happening here to the foot. The muscles are constantly pulling it down and in. This isn't just about feeling stiff. It can fundamentally change how a person stands and walks, making something we take for granted incredibly difficult. Okay, so how do you even begin to manage this? That brings us to our framework for today, the treatment ladder. We're going to start right at the bottom, on the very first rung, with the most common go-to approach. So, the first line of defense, it's almost always going to be oral medications. We're talking pills that work systemically, which just means they travel through your whole body. The idea is to get those overactive muscles everywhere to just chill out. It's a broad approach for sure, but it's the least invasive way to get started. But here's where we see the big trade-off right away. You've got different drugs here, and they all work a little differently to calm things down. But look at the side effects. You see the pattern, right? Sedation, confusion, muscle weakness. The very thing you're taking to help with muscle tightness might make you feel tired or weak all over. It's a constant balancing act. So what happens when those pills aren't cutting it? Or maybe those side effects are just too much to handle? Well, that's when you start climbing the ladder to treatments that are much more targeted and localized. And that brings us to something you've probably heard of, botulinum toxin, or BoNT/A. Now, this is a really cool mechanism. Instead of a pill that goes everywhere, a doctor injects this directly into the one or two muscles that are causing the most trouble. It basically works by hitting a temporary off switch on the nerve signal, telling that specific muscle to relax. The catch? It wears off in about 3 months. But injections aren't the only game in town for targeted treatment. On the other side, you've got something called shockwave therapy. This one is totally non-invasive. It uses these powerful sonic pulses from outside the body to help break up that muscle tension. So you've got a needle on one hand and sound waves on the other. Totally different tools, but they're aiming for a similar, localized effect. But here's the thing, and this is a really critical point for this whole section of the ladder. Both of these treatments can be pretty good at reducing the stiffness, the muscle tone. But the million-dollar question, the part where the jury is still out, is whether that actually helps a person function better. Does it really improve their walking or their ability to use their hand? The evidence on that is still pretty mixed. Okay, for really severe spasticity, the kind that affects multiple limbs, we have to take a huge step up the ladder. And that brings us to the intrathecal baclofen pump. This is a small, hockey puck-sized device that's surgically implanted under the skin with a tiny tube that feeds the drug baclofen directly into the fluid around the spinal cord. And this just perfectly lays out the high-stakes trade-off. On the plus side, because you're putting the medicine right where it needs to be, you can use a tiny fraction of the dose you'd need with pills, so you avoid all those sleepy, confused side effects. But, and this is a big but, it requires surgery with all the risks that come with it. And even scarier, if that pump or catheter fails for any reason, the sudden withdrawal from the drug can be a life-threatening emergency. And now, we've reached the very top of the ladder. Surgery. These are the big guns. These are the final options for when other treatments just haven't been enough. They are invasive, often changeable, irreversible, and yeah, the stakes are the highest here. So first up, there's selective dorsal rhizotomy, or SDR. This is an incredibly complex neurosurgery. The surgeon actually goes into the spine, tests the sensory nerve fibers one by one to find which ones are firing off those haywire signals, and then they literally snip them. It's a permanent change to the body's wiring, and it's most often done for kids with cerebral palsy. And look, here we see that same theme pop up again. This quote from our source material just nails it. SDR is really, really good at what it's designed to do. It dramatically reduces spasticity. But just like with the other treatments, whether that reduction in stiffness actually leads to a real-world improvement in functioning, well, that's still a big debate. Okay, get ready for this next one, because it really does sound like it's been pulled straight out of science fiction. It's a radical idea that just completely challenges how we think about the nervous system. It's called a contralateral C7 nerve transfer, and it is wild. Surgeons will take a nerve from the patient's healthy arm, tunnel it across their chest, and then hook it up to a nerve on the paralyzed side. The hope is to basically create a brand new highway for signals from the healthy side of the brain to get to the affected limb. It's a new technique for sure, and they're still figuring all out. So, okay, we've climbed all the way up this ladder from a simple pill to literally rewiring the body's nerves. Where does that leave us? What's the bottom line here? And the honest truth is, there's no magic bullet. There is no perfect treatment for spasticity right now. It all comes down to this delicate balance. As you go higher up that ladder, the treatments get more powerful and the relief lasts longer, but the cost is always greater risk and more invasive procedures. And yet, despite all those risks, listen to this. This is fascinating. For patients whose lives are severely impacted by spasticity, the authors here actually recommend surgery as the first choice. The argument is that for some, a one-time, permanent fix, even with its risks, might be better than years and years of less effective treatments. Which really leaves us with the big question, doesn't it? The treatment ladder we have today is built on a series of really tough compromises. As we look to the future, is the perfect fix going to be a better, more precise surgery, a smarter drug with no side effects? Or is it going to be something we haven't even imagined yet that makes this whole ladder obsolete? It's an incredible question, and one that researchers are working tirelessly to answer.